Welcome, dear viewers. Nice that you are with us again on Health Television. And yes, health is not always optimal, and sometimes high blood pressure troubles us. Unfortunately, this is a very widespread phenomenon or a widespread symptom, which can, of course, have different causes. But a truly good solution is rarely found, except for the conventional medical prescription of medication. And that is actually just a symptom treatment. Luckily, we have guests today from whom we can learn how we can ultimately actually return to health in completely different ways and achieve normal blood pressure. I'm looking forward to my guest today. Dr. Jürgen Strein is with me and one of his patients. And we will hear firsthand about his experience with his high blood pressure. So stay tuned. I'm looking forward to seeing you and, of course, my guests as well. See you soon. So, welcome. It's nice that you're here. First, I'll start with the patient, Hans Enz. Welcome. I'm glad you took the time to tell us firsthand how things went for you. On the other side, Dr. Jürgen Strein, you are a specialist in general medicine. I'll ask you about your other focuses in a moment so that people know a bit about your fields and competencies. You work at the Biomed Center Sonnenberg in Schwellbrunn. I just ask you to briefly tell us what is your background, what are your specialties there?
Yes, thank you very much for having me here. I have been at the Biomed Center Sonnenberg since September 23, and we work purely biologically. Before that, I also had my own practice in Germany, and I basically did a split between conventional medicine and biological medicine and have now finally decided to work purely biologically. Endgültig entschlossen, also rein biologisch zu arbeiten. Because I enjoy it much more and the progress that I can observe is also very good. Die ich mit anschauen kann, also die sind auch sehr gut.
You're talking about biologically. Could you maybe give us a brief overview of what that exactly means so that the viewer can assess it well? What does biologically actually mean?
So we work with purely natural agents, for example, with plant-based agents. We work with homeopathy. So we work with orthomolecular medicine. We work with hypothermia, that is with heat, with the goal to overheat the tissue, to then increase metabolism there and promote reactions that are helpful for healing. Just to give a brief outline of how we work. Nur so einen kurzen Abriss zu geben, wie wir arbeiten.
So hypothermia is something that the body can also do naturally, for instance, by developing a fever. And you induce it with your methods to achieve what the body also does in this case.
Yes, it's not as strenuous for the patient as having a fever, more comparable to a sauna. Ideally an infrared sauna, which comes closest. But there, deep processes in the body are all already stimulated, which are important for the healing processes. Especially worth mentioning is neural therapy. All doctors at our Biomed Center also work with neural therapy. Neural therapy is indeed a stimulus therapy like acupuncture, for example, only that in addition, procaine or another local anesthetic is administered to again provoke a special reaction on the neuronal level. To trigger, ideally, for example, in pain patients, you can erase the pain memory in the nerve cell and then basically restart the cell.
Startet dann quasi die Zelle wieder neu. Like a reset on the computer, right? To compare, yes, very good. Amazing what things there are. And indeed, the stimuli are also very important for our health. cold stimuli, heat stimuli, and other stimuli that we otherwise have. Sometimes hunger too, so fasting and so on. So very appealing, everything related to nature. Our body also comes from nature, not manufactured in a factory, assembled and standardized. And that's why it has always been more logical, biological to me, that one should orient themselves by what the physique does. Otherwise on the normal path and what can serve it best. I think we all agree that medication, chemically produced drugs, can't really be the solution. It can be valuable and helpful temporarily, but it's not a permanent solution. Now, we all probably know someone in our families or circle of friends with high blood pressure. That's our main topic today. The solution I know is simply blood pressure medication. Correct me if I am wrong. I've had it myself before. I just went to the doctor with very high blood pressure, and then I reluctantly took these blood pressure medications and it knocked me out completely. Really, the complete opposite. Although I only took a little. How do you approach it now? Or maybe let's first start with what could be the cause of high blood pressure?
Yes, because there can be many causes. A reduced blood flow from the kidney could possibly be causal. The vessels become less elastic over time. That can be the main problem for most.
We'll continue shortly, dear viewers. But at this point, we would like to present to you a very, very important excerpt from a special program. It only takes a few seconds, and if you are just as thrilled by this excerpt as I was, then you will find the link in the title, in the description on YouTube below. Click on it and watch the whole program. Have fun!
People who ask questions whenever wanted, at any time. What I write there in the book is practically like a plan on how to perfectly enslave people mentally. And extreme stress, constant extreme stress, shrinks the hippocampus. So if my hippocampus shrinks, myself also shrinks. If myself shrinks, it is weak. If I want to dominate the society, then my aim must be to paralyze exactly this part of the brain.
Usually this is not precisely investigated or established. Then it is called essential hypertension. So this expresses the diagnosis that the ultimate cause has not been found, but it likely plays a role within the context of altered blood circulation or the rheological, the flow properties of the blood that have changed.
Wahrscheinlich eine Rolle spielt oder die rheologischen, die Fließeigenschaften des Blutes, dass die sich verändert haben.
Okay.
Ja.
Okay, now may I come to you, Mr.? And so once again, it's nice to have you here. And what brought you to the Biomed Center? I assume it's high blood pressure, logically. Yes. But were you, let's ask differently, had you been to other doctors before, and potentially how long have you been searching because of these complaints?
Yeah. Yes. Well, I've known Dr. Rao since the 1990 seconds in connection with his lectures on prostate cancer prevention, and I have always been fascinated by his holistic approach. Und ich war immer fasziniert von seinem ganzheitlichen Ansatz. I don't have any major health problems as such, but at the beginning of this year, I was briefly in the hospital in connection with diverticulitis and the subsequent colonoscopy. Und mit anschließender Darmspiegelung. And in this context, it was found that I have high blood pressure. They measure that. And I have a white coat syndrome. That means when a doctor measures my blood pressure, it shoots up. Misst, dann jagt's diesen Blutdruck in die Höhe. In this context, I was also worried and turned to my GP and asked what I should do. Hausarzt zugewendet und gefragt, was soll ich tun? And then he prescribed me ACE inhibitors. Verschrieben. I didn't tolerate the ACE inhibitors well. I always had a dull head in the morning, a so-called Föhnkopf. And otherwise, I didn't find it a good solution. And then I looked it up on the internet under the keyword doctor. Unter dem Stichwort Dr. Rau.
Rau, high blood pressure.
And that's where I saw a video of him. And so I came up with the idea, now I have to register at the clinic and with Dr.
Und beim Dr. Stein.
Stein. I was then admitted at short notice and had a conversation with Dr.
Habe ein Gespräch geführt mit Dr.
Stein and of course also reported my problem with the white coat syndrome, which blocked me from measuring my own blood pressure.
Das mich blockiert hat, selber Blutdruck zu messen.
And Dr. Stein then came up with, in my view, a very original idea, saying first we'll do something different, a hypnotherapy, so you can overcome this problem of measuring your own blood pressure.
Dieses Problem überwinden können, nämlich selber den Blutdruck zu messen.
So I then came to Miss Claudia Nüffeler, and in a very pleasant atmosphere, after a few sessions, I could suddenly measure my blood pressure again under normal conditions, and then I was ready for the therapy that the doctor...
In einer sehr angenehmen Atmosphäre, nach ein paar wenigen Sitzungen, konnte ich plötzlich wieder unter normalen Verhältnissen meinen Blutdruck messen, und dann war ich auch bereit für die Therapie, die Herr Dr. Stein dann...
Stein then suggested.
Die Therapie...
The therapy was then started in May and actually completed very successfully within a relatively short time after a few months.
Zeit dann sehr erfolgreich abgeschlossen nach einigen Monaten. Die Therapie
The therapy consisted on one hand of administering these Rauwolfia drops, very effective, with restorative and detoxifying infusions.
Tropfen, sehr wirksam, mit Aufbau- und Ausleitungsinfusionen.
And after 3-4 months, we could see that my blood pressure was lower than even a normal one.
Tiefer war als sogar ein normaler Bluthochdruck.
Blood pressure for my age. I'm 83 years old and have no major complaints otherwise. And so we solved the problem. And now I have, of course, immediately stopped taking ACE inhibitors. That's clear. And now I feel well and have no medications I need to take in this regard.
Medikamente, die ich jetzt einnehmen müsste, diesbezüglich, ja. Also,
so a great success, and I congratulate Mr. Dr. Straheim for the approach. Hypnosis first and then the therapy.
Die Therapie.
Well, you also look fantastic, I must say, for your age. I think that's really great. And yes, that you also committed yourself to such a, I say now, biological therapy, which ultimately made the difference. And it can be that simple. Did you have any side effects from these drops?
No, not at all. Nothing at all.
And probably not from the hypnosis either, which then improved things. You mentioned the white coat syndrome. So that means even at home when you measured it, was it automatically high or how? Because there was no white coat present.
Yes, that was a special phenomenon. Apparently, I was so internally stressed expecting the blood pressure to go down. It is too high, and somehow it didn't work for me anymore. And thanks to this hypnosis therapy, the problem was solved.
Indeed. May I ask you again, what do these Revolvia do? Did I say that correctly?
Yes, Revolvia.
That is indeed a preparation for lowering blood pressure in a natural way. But now he didn't even mention the main work, because that's what he did.
I just thought, yes.
We had discussed in the first conversation about changing to a plant-based diet. And he did that really well. So there was nothing to complain about. Thank you very much. Then the other point was indeed, that wasn't the approach with every patient who comes with high blood pressure, but the problem that he can't measure at home, that's what ensured that we couldn't make progress with the therapy. Then a quick solution had to be found, and we did that in the form of hypnotherapy. I believe there were 2 sessions with Mrs. Nüffler, and we were able to successfully solve the problem. And then the therapy could continue to be conducted well.
So due to the measurements that were not possible at home, it wasn't possible to say, how is the progress, what is the course, is it working? That was the problem. There are also such 24-hour measuring devices that can be used, but that is something long-term. You can't use it for that long, of course.
We used that for therapy control. We did that after a certain period, after half a year, or you conducted it, I believe.
Yeah.
Exactly, and that was very good, and the family doctor was also impressed. And
how long did it take until you felt a positive effect?
Well, about 3 months. The whole process took that long, 3 to 4 months.
But the first results were better even before that. So I would say about after the dietary change, after 3-4 weeks, you usually see the first good results.
Yes. I then measured regularly 4 times daily for 2 months. And you could clearly see how it went down. Yeah. Yes.
What was your diet like before, if I may ask, when you say the plant-based diet was like that?
So more meat, more protein, and now, of course, less protein, less meat.
But you still eat meat, protein, or eggs, and so on accordingly. So less and more plants, so the ratio has changed. Exactly. Okay, wonderful. What other measures are there to lower high blood pressure?
Zur Senkung des Bluthochdrucks.
If I may just briefly summarize regarding nutrition, that's actually the case. Especially in blood pressure regulation, it is extremely important that microcirculation is improved and the body is deacidified. This happens through a plant-based diet. You can't achieve that with any other diet, but you can with a plant-based one. That's why the result with Mr. Ernst is so excellent. Because for the first 2 months, I believe they strictly followed the dietary recommendations. Then the metabolic change occurs, and after that there are smaller exceptions. If he then eats a chicken, a poulet, occasionally on weekends, it no longer weighs so heavily.
Okay, yeah.
What other measures would you recommend to a patient with high blood pressure?
Exercise is another very important factor. So half an hour a day, a brisk walk, maybe getting out of breath is very important. You don't have to have Olympic ambitions. You shouldn't overdo it and not start jogging right away, but start with working on basic endurance first. So please don't be too ambitious there. That's a very essential aspect. And also sleeping and waking should be in a good relation to each other. That is also very important.
When it comes to exercise, people also talk about the difference between aerobic and anaerobic exercise. That's probably also why the advice is not to overexert oneself, because everything that stays in the aerobic zone, you then have better oxygen supply, or is that correct?
That is correct, but it's also about the tendons and ligaments. So the joints, they take about 2 months to get used to the stress of running. And if you are too ambitious, it often ends with knee problems or other joint issues.
Do you also exercise? I assume so, yes.
Yes, of course. Great. Half an hour a day, preferably in the forest. Very good. With the goal of reaching 100 heartbeats each time. And that is, of course, a daily program. It's a must. I also live conveniently situated. I live near the edge of the forest, so I can do these exercises there. And sleep, I have no problem with that either. On average, about 8 to 9 hours. That's my need. So that aligns with these requirements.
Indeed. Yes, you often hear that too. Sleep is also such a topic. Many people just sleep poorly, waking up frequently during the night. So is that always necessarily a side effect of high blood pressure patients?
It can be that a lack of sleep also causes high blood pressure. It's not always the case, but it's often the case.
Okay, wonderful. Yes, so then I'm glad that you mentioned, we also talked about Hashimoto or thyroid. Do we want to say a sentence about that?
Well, he came into treatment with both diagnoses. We addressed the general treatment. We didn't specifically treat against Hashimoto. We treated him generally as a patient. But nevertheless, the autoantibodies also decreased well. That is what he wanted at the beginning of the treatment.
What do you attribute that to? Specifically, also to the plant-based diet?
Yes, partly as well. We also administered targeted detoxification infusions to help eliminate toxins from the body, because this is often the case with high blood pressure, that you additionally find toxins. So we always conduct a combination therapy. We look at the condition of the gut. We treat the gut. We detoxify. And then we look very specifically with neurotherapy whether there is still a need for intervention.
Okay. So I think it's great when you look at people holistically, which is something that the average general practitioner neither has the time nor necessarily the knowledge that might be behind it. But it's the only way, right? Probably to look at people holistically and really help them holistically.
That is certainly the most pleasant way.
Yes, with many positive side effects. Then I'm glad that you are sitting in front of us in full health and are with us. And I also wish you that it stays that way for a very, very long time and that you still have a lot of joy in life. Thank you for being here. Thank you too. Dear Jürgen, thank you for being here and giving us some insights into a patient or the patient, into the treatment process, so that we could go along a little. Thank you very much.
Thank you very much from me as well.
Thank you very much. Thanks.
Dear viewers, nice to have you with us. I hope we were able to bring one or the other aspect closer to you in case you are affected by high blood pressure, which is so widespread. And unfortunately, cardiovascular diseases are still at the top of the causes of death. Therefore, don't just overlook it, but become active and, best of all, holistically and biologically. In this sense, I wish you, on behalf of my guests, health for body, mind and soul. Take good care of yourself, be vigilant, mindful and loving to yourself, and feel free to join us again next time. I would be delighted. Until then, Goodbye.
Thank you very much for watching from Swiss Health Television QS24. Please also go to Wikisana, register there and watch all these programs without commercial interruptions. And please subscribe to this YouTube channel as well. This helps not only us, but also the further distribution of our station. Here is a selection compiled for you. Have fun, all the best, until another time. Goodbye everyone.